Good afternoon, everyone. Thank you, Jay, for the introductions. For those observing Ramazan, Ramazan Mubarak from Maldives. I am Aishath Samiya, and with Deputy Director General Moomina, we will present the Maldives Health Sector Digital Transformation Plan, highlighting where we are today, what's driving the urgency, and how Maldives 2.0 guides the next phase of digital health transformation in the Maldives. I'll begin with the Maldives health system context, what is already in place, and then Deputy Director General Moomina will take us through the Maldives 2.0 initiative and how it aligns with the Maldives digital health blueprint. The Maldives is a small island nation with a population of just over 500,000, including our expected population. Expected population is also about 1/3 of overall population, with about 6,000 to 7,000 yearly births and about 1,200 to 1,400 annual deaths. Our population is showing the same trend as many other countries, which is a reduced fertility and increased aging population. In addition to this demographic transition, Maldives faces challenges in healthcare delivery, which is unique to the geographical distribution of our country. As an archipelagical nation, Maldives has over 1,100 islands, but only about 16% of these islands are inhabited. For administrative purpose, our islands are divided or grouped together into 21 atolls, which is similar to the concepts of districts in some of the other countries. Also, only 1% of Maldives territory consists of landmass, thus our population is highly dispersed across these inhabited islands across the country. Our healthcare system has to be designed to tackle this high geographic dispersion while still trying our best to ensure we provide equitable access to healthcare service delivery to every resident of Maldives. In this regard, our healthcare is delivered across 3 levels: the capital, the atoll level facilities, and the island health facilities. The island health facilities or the health centers, which is the backbone of our primary healthcare service delivery, handles the provision of essential healthcare services at island level, while atoll hospitals in the second box in the middle caters to higher level secondary care or tertiary care for their catchment population. The capital, which we call as the Greater Malé area, houses the main national referral hospital designed to cater for more complex cases. Capital also has other tertiary public hospitals as well as private tertiary hospitals, as well as a number of private clinics. In addition to this, as just touched a bit, we have a mix of private and public providers, but most of our private service providers are located in the capital region. There would be at least one public healthcare provider in each of the inhabited islands of the Maldives. Maldivians are also entitled to free access to healthcare service across the country and to empaneled facilities in neighboring countries through our national health financing scheme called ASANDA. We already have multiple digital systems operating across the health sector in the Maldives. I will now provide a brief overview of each. At the national level, Vinavi portal supports the National Health Financing Scheme or ASANDA. This system is used to manage payments and claims and is integrated with the hospital health information systems. So there's a seamless connection between the ASANDA system and the hospital information systems, as well as connection of the ASANDA system with the pharmacies. Major hospitals in the central region have their HMIs tailored to their needs. The GAMEN is a digital birth and death registration platform. All births and deaths that occur in the country are entered into this system and it's visible to all the users. The AeHIN platform plays an important role in national reporting and hosts several programs in several specific modules. Many health facilities also use desktop-based health information systems for their operations. You've seen a snapshot of like the main systems, information systems used in the health sector. Now the problem is not the absence of systems. We have them, we have a lot of them. The real issue is fragmentation. These systems are not fully connected, and as a result, data remains stuck in silos. This affects efficiency, undermines clinical decision making, and limits the value that we can get from all these digital investments. Our focus now has to be on integration, breaking down these silos so data flows securely between systems, enabling smooth operations and better patient care. So, the most important thing which I would like to touch base is patient care. The urgency for digital transformation comes from the need for efficient, quality, safe healthcare that we see, that we desire, that we work for every day. As mentioned earlier, geography alone makes access uneven, especially when people are spread across islands and distances quickly become barriers to timely care. Especially services are still concentrated in the capital, which means many patients must travel or wait before they can be properly assessed or treated. At the same time, fragmented systems create friction at every step. Patients repeat tests because results aren't available. Clinicians work with incomplete histories, and referrals are slowed because information doesn't flow with the patient. When overseas referrals becomes the only option, the cost is high, but not just financially, in time, disruption, and seen as a risk. And as chronic disease grows, the system needs something it can't deliver through episodic care alone. Continuity, coordination, and follow up over time becomes essential. When data is disconnected, services can only respond to what's in front of them. Care becomes reactive rather than planned, preventative, and connected. Moving on to the Maldives 2.0 digital transformation in 2024, His Excellency President Dr. Muizu launched the Maldives 2.0 initiative, which sets the national direction for digital transformation with 8 pillars. Under Pillar 7, which is relevant to our presentation and our context, the digital transformation of the health sector is included alongside other key sectors. The aim across all sectors is the same, which is to move away from standalone, disconnected systems towards interoperable platforms which can exchange data securely and support better services for people. For health, it translates into patient centered digital services, secure information sharing across levels of care, and stronger decision making based on reliable data. In other words, health is part of a broader national effort to build a connected digital ecosystem designed for the Maldives context, where systems work together and scale sustainably. Maldives 2.0 under Pillar 7 of sectoral digital transformation gives us the national direction. And it matters because it translates the vision for digitalization into real improvements in care. First, it helps expand universal access. In the Maldives, geography shapes health outcomes, and access can depend on distance, transport, and timing. With digital services, care can reach people more consistently across islands, reducing delays and making follow up more reliable. Second, it enables an integrated, interoperable system. Patients move between islands and levels of care, but their information often doesn't. When systems are fragmented, we see duplicate tests, incomplete histories, and referral delays. Third, it empowers patients. A digital ecosystem isn't only for providers, it must work for citizens. When people can access their records and understand their care, they can take a more active role with clearer follow up and more continuity as they move between facilities and services. Fourth, it strengthens public health decision making and emergency response. When data is timely, trusted, leaders can detect risk earlier, plan better, and coordinate faster, whether it's routine monitoring or an outbreak where every day, sometimes every hour matters. And finally, it builds resilience and inclusion across all islands. Transport disruptions and service pressures will always happen, but information doesn't have to stop moving. With secure digital systems, care can remain connected and even under stress. So every island benefits from the same visibility, continuity, and standards of care service. With this foundation, I would like to invite the Deputy Director General Moomina to take us through the Maldives 2.0 initiative and how it translates with our digital health blueprint.
Thank you, Permanent Secretary Sami. As Sami has briefed about the 8 pillars in the Maldives 2.0 initiative, these pillars strengthen the digital public infrastructure, which will help us to drive the digitalization in the health sector. For example, under Pillar 1, we have the digital identity and trusted transactions. The digitalization of the health sector will ensure that the unique health ID aligns with the national identity framework. The goal is one trusted identity that supports safe access to health services and which is linked to the health records. Then under Pillar 2, we have open data sharing and governance. The health information exchange aligns with the National Maldives Data Exchange. This ensures that the health sector is not built in a separate exchange system, but instead adding a health-specific standards layer and rules on top of the national backbone. Pillar 3, cybersecurity for national resilience. And Pillar 4, modern legal framework for digital trusted and governance ensures the data security and strengthen the health data governance. Under Pillar 5, we have secure and sovereign digital infrastructure. The requirement for a health cloud aligns the government direction for a sovereign cloud hosted in the national data centers. These is essential for data protection and trust for the long-term resilience. Therefore, these DPIs will deliver and will strengthen the health sector digitalization in a structured and coordinated way. As outlined in Maldives 2.0 roadmap, a strategic initiatives, we are taking a phase foundation first approach. We start by setting the direction and ownership, approving the Maldives Digital Health Blueprint, establishing a clear national vision, and launching the digital health unit creates the leadership, coordination, and accountability needed to make this a long-term national program. From there, we move into building the backbone. We will design and pilot the National Digital Health Record core stack, beginning with the essential identity and interoperability and the standards. In parallel, we will be working to strengthen the enabling environment, which means that we will be developing and adopting digital health policies and standards, clarifying the governance arrangements, and invest in capacity building so that our health professionals and national team can operate, maintain, extend these platforms sustainably. Once these foundations are in place, we will then be scaling the services. We will develop the telemedicine 2.0 program plan, then launch and deploy it to expand it for specialist reach and strengthen the referrals across islands. As rollout progress, we will continue to review and update the policies and our standards to keep the system consistent, secure, and fit for the purpose as it grows. Finally, we shift from a pilot core stack to a full-scale developing and rolling out the complete national digital health records, connecting our services into one unified ecosystem. With the right foundations, growth becomes sustainable and the systems can be expanded. This is our digital health blueprint, the national guide for how we modernize and connect the health ecosystem over the coming years. The blueprint will help us to move from a situation where systems have developed in isolation to a future where we have shared architecture and coordinated national priorities. It also gives us a common language across stakeholders, ministries, most digital services and health facilities, public health programs, and developed partners so that everyone is working towards the same goal. As the key deliverable, the The blueprint provides architecture and standards. It defines the governance and institutional setup. The blueprint also lays out phase implementation roadmap. It comes with a costed plan, which allows us to align the government budget and develop partners to support around the shared prioritized pipeline. So overall, these deliverables, which are also part of the Moody's 2.0 roadmap, are designed to take us from a fragmented landscape to a coordinated national-wide digital transformation. Now, to bring the digital health blueprint to life, I want to just briefly show the heart of the Maldives digital health ecosystem architecture, the core. At the center is the unique health ID. This is essential for safely linking a person's health records across facilities and across all levels of the care. Around that, we have the Health Information Exchange, which enables secure and standardized data sharing between systems rather than keeping the information locked in silos. We also see the master data repository and a terminology master. This ensures consistency in how data is stored and how clinical and public health terms are defined and used across the country. And supporting all of this are the national registries for facilities, professionals, and health workers. This registries help standardize service delivery and strengthen the accountability. So in short, the core is what turns our digital health vision into a connected reality, supporting safer care and better planning. If we implement this well, the benefit shows up in a very practical way across citizens, providers, and health system as a whole. First, it improves equity and access. Telemedicine and shared records reduce the need for travel, especially for people in remote islands. Care become easier. Second, it strengthens the workforce reach and continuity. Specialist capacity might be limited, but remote support and digital training can extend that capacity to our outer islands. Third, it enables coordinated care. With interoperable systems and a unique health ID, providers can see a single patient view across services. This means that smoother referrals between facilities and better continuity of over time. Fourth, it also drives faster referrals and lower cost. E-referrals that include complete patient history, reduce delays, and information loss. It also cuts duplicate testing and helps avoid unnecessary transfers. Fifth, it improves safety and reliability. Unified electronic records reduce loss of incomplete and support the safer care through a stronger medication and also it will help to check for allergies, clearer documentation, and better accountability across our providers. And finally, it supports better chronic care outcomes with continuous follow-up and tools like remote monitoring. Non-communicable diseases can be managed more proactively, supporting early interventions and ultimately lowering the preventable hospitalizations. Other than this, there are multiple benefits such as enhanced data-driven policies and planning, and also emergency preparedness and response through real-time health emergencies. There are several steps that need to be taken to deliver this transformation. First, we will need a technical support from our colleagues, from AeHIN and other experts, so that it will help us to develop and implement the national health policies and standards and data governance framework. Second, we need support for capacity building. The technology will only be strong as the people running it. We need international support to train our healthcare professionals and technical teams so that national standards, data governance, and information exchange become embedded skills, not just external, and we don't have to depend on external support. Third, we see a strong opportunity for collaborative research and innovation, partnering with, for example, AeHIN members, universities, research institutions, and global health can help us co-develop tools that fit the Moody's context, testing what works in an island setting and sharing lessons that can benefit others as well. And finally, we want to strengthen an alignment with the Sustainable Development Goal. This work directly will support the SDG progress, especially universal health coverage and stronger health systems. And we are looking to connect with global partners working towards the same outcomes. This concludes our presentation. Thank you, and we are happy to take questions.
Participants, if there are any questions for our speakers, please to ask. I do see one. So this is from Francis, Philippines. As you work to implement your digital health strategy to meet your, let me open this. To meet your health goals, what have been the most significant unexpected risks you have encountered, and what practical steps and strategies are you using to mitigate them? Thank you. Over to Sami and Moomina.
Thank you. So we have just very much initials because the DPI's work has been an initial work in the Maldives. But however, we do have a digital identity, established digital identity that we have been using for a long time. So we are not going to duplicate it in a way that we are going to do a unique health ID. As the experts and our discussions with our Maldives digital services, we will be having the unique health ID on top of the digital identity. So those are the initial discussions that we are having. So other than our digital identity, other DPIs are in a very initial stage, and then we looking into our expected risk. We might be facing challenges and risk when we are working because when we are trying to reduce the duplications. Even though we are talking about a health information exchange layer, the Maldives, as I have mentioned in my presentation also, in the pillars, they have in the government priority is to have Maldives exchange. So we will not be duplicating that also. So that might be in a very initial discussions. That was one of the challenge that I faced when we were talking about having health HIE also to have a separate HIE. The government, the policy level were discussing not to duplicate, but to have a layer in the Maldives exchange layer for a health. So that was one challenge that we would have to. But the good thing is that the experts in the Maldives digital health services, they are very much working very closely with us. They listen to us and they know that the health is very unique in a way. So they are trying to accommodate with our requirements also. Thank you.
Thank you. If in the meanwhile, I just wanted to make a quick comment. It was very interesting to see there are 5 pillars shaping your healthcare services vision or agenda. And then there are also 5 pillars that were for the digital health. So my quick question in the meanwhile, like we collect other questions, is like, is there a link? Did you actually build the 5 pillars, or did you actually form those 5 pillars that are meant for digital health based on the 5 pillars that was for the health sector, or is there any interrelation?
Thank you, Jay, for the question. There is actually no direct link between the health services like main areas to the digital health areas which we've worked on or formulated. So when we were working on with multiple stakeholders and with technical expertise on the Maldives 2.0 health component, as well as the digital health architecture blueprint, this was purely based on the best approach in which also reflects the Maldivian context of moving forward on the digital health initiatives which we planned to achieve the broader digital health vision for the Maldives. So simply saying, no direct connection.
Thank you, Sami. There is another question. This is from Dr. Mahesh. He's the head of digital health at the Ministry of Health in Malaysia. So he is asking, how are you structuring governance to ensure interoperability across public and private providers, especially in a geographically dispersed island system like the Maldives?
In the presentation, thank you for the question. In the presentation, we've mentioned that there is very strong political commitment. The initiative of Maldives 2.0 comes from the president in the president's office. There's a digital council at the president's office. The president is chairing the digital council with ministers representing the different sectors in the council. So all the major decisions related to Maldives 2.0 are by the digital council. A new establishment has also been institution called the Maldives Digital Services has been established last year after the Digital 2.0 was launched. So there's very strong commitment for the Digital 2.0 and health sector being like a component of the Digital 2.0, Maldives Digital 2.0. There is commitment politically, financially, and the technical expertise which is available in the Maldives digital services would also be concentrated or prioritized to implement the Maldives Digital 2.0. So, as this is coming from the government with the strong governance, and we have a Health Services Act, whereby the Health Services Act states that the overall health system comprises both public and private. So any digital effort or like any health services policy which we implement in the country applies to both public and private. So we have the governance mechanism as well as a regulatory mechanism which supports implementation across public and private. Anything to add more?
Also, as blueprint and also in the roadmap, Maldives 2.0 roadmap, we also have highlighted that we will be setting up a digital health unit in the Ministry of Health. So that would also be like a direct connection with the Maldives digital health sources to help us with for strengthening the standardization and to have that collaboration across all our island health facilities.
Thank you, Sami and Mumi. I just posted the link on Maldives 2.0, President's vision for the digital transformation. So if anyone is interested to actually know more details, you could actually refer to that. And then in the meanwhile, we do have, I think there is a comment from Dr. Nitin Bhandari from Medic. He's based in Nepal. So he says the presentation highlighted. He first thanks for the insightful presentation, and then he says it highlighted the growing NCD burden in the country. Could you elaborate on the ministry's strategy to identify and address the hidden and undiagnosed burden of the NCDs? Additionally, how are digital initiatives supporting early detection, continuity of care, and service delivery?
Thank you, Nitin, for the question. So, like 80% of our burden are from non-communicable diseases. So, that huge burden, and this is similar to like many other countries in our region and globally as well. Our approach to NCD, early like prevention, early identification, and to ensure that there's continuation of treatment is through primary healthcare approach. So we've established with support from WHO and other partners, we've established an approach of primary healthcare approach, and we piloted this in one of the atolls, whereby we used to stay in the hospital or health facility, waiting for the patients to come, and we find that when they come to the hospital or health facility, usually they are like at very advanced stage, needing like lots of care, and the cost is also very high at this stage. So the approach that we brought in through primary healthcare is the healthcare teams go into the communities. So we visit each household, and then we collect sets of information from anybody who is above 18 years of age from the household, and there are like certain risk factors that gets calculated through the system. So primary healthcare system is like data is entered into a DHIS2 platform, and they have mobile apps as well, so that this can be captured by in the community, and the information flows into the hospital, and there's some risk factors that's calculated automatically from the system. So there's like heart risk, NCD risk that's calculated automatically for people of a certain age group. And then, if we found out we've implemented this in 12 atolls to date. So this year in 2026, we would roll out to the remaining atolls. But it's a huge, huge effort. One thing is just rolling out, the other one is going into like each household, capturing the information so that there is like complete information of the public in one system. So this project is also ongoing. The DHIS2, as we've mentioned in the presentation, would be linked with the Maldives 2.0. So the information will flow into the Maldives 2.0 platform, so that this will also be like in the data exchange, and this information will flow. Once we establish the Maldives 2.0 health initiatives or health plan, the information will be available to like different centers. Currently, the information that's available is in DHIS2 and in the facilities that's using DHIS2 PHC platform.
And also, I think, Sami, it's also very interesting that what Sami has mentioned about the PHC module, and also we have already developed how the public can view those data. It's a public portal. We call it a Maldives Integrated Health Information System, or MIHIS. So it was launched in 2024 December. And also, we are trying to align that in the Maldives 2.0 roadmap, because we will be expanding that system on how public and citizens can view their own, empower the citizen, and how they can view their own data. So we will be calling that as more MIHIS 2.0, and we will be expanding that in our next phase.
But even currently, Moni, the public will be able to see through the MIHIS portal the primary healthcare information that's captured in like 12 atolls, as well as the online digital vaccine information. Thank you, Jay. Hope we've answered the question.
Yeah, thank you. I think, you took your time and very nicely explained. I really liked one of the previous points that was made. All these things are not for the providers. These are meant for use by the citizens. It's for the public to use. I think that's a very powerful statement. And then I think that's where the whole focus should be. So it also nicely, like what Moomina mentioned towards the end, like, it's also like public facing, like, the public should be able to actually see. So it very well connected to that point. And then if there are no further questions, I don't think we need to wait till the end. I do see one comment. Let me check. Something is that, yeah, it is just like Dr. Nitin is thanking and encouraging the work. So if there are no more questions from those participants here, let's give our speakers who are also in the, I think it's also the fasting end time, right? So probably I think we should close early and then get them an early and then so Dr. Mahesh also replied, "Thank you very much for the insightful presentation. It is encouraging to see the clarity of vision and the structured approach Maldives is taking in advancing digital health agenda. Truly appreciate you sharing your journey and lessons learned. Wishing you every success as you move into the next phase of implementation." Thank you, Dr. Mahesh. And then, this is, I think we had a very comprehensive presentation and then a very leisurely, interactive explanation for all the questions that we had. And then I think it's also the time that usually people are busy at this time. And then that's also the reason.
Ramadan.
Yes, exactly.
Ramadan.
That's exactly the reason. So we will have usually more number of participants, but then I think one is like this recording of this webinar will also be available, and then because usually a lot of people ask for this recording, so I'm sure that a lot more people will look at it, and then also there will be some queries that may be coming up. And really, thank you very much for being with us and then sharing your National Digital Health Program. And we look forward for further updates as and when it is possible.
Thank you.
Thank you, everyone.
Thank you.
Very much.
Thank you. Bye.
Thank you.